Research actually shows that up to 50% of Australians have done CPR training, but most of them did their training more than 5 years ago. So I reckon we need a national update.
Well, we're in luck because we've got some help. We've got two people here who are going to teach us a thing or two. They're from the St John's Ambulance. We've got Katie and Tatiana. Hello. Come to the rescue to help us out.
Welcome, guys.
Thanks for having us.
Thank you for being here. Now, what's the most common mistake that people make when doing CPR?
Yeah, I guess there's quite a few mistakes people usually do make, unfortunately. But I reckon the most common would be forgetting to call for help. So actually calling an ambulance is really common.
Is that the first thing you do?
Not the very first,
No,
yeah.
okay.
So there's actually a full action plan that we're going to run through.
Right.
But, yeah, that send for help is really a critical step, as you can imagine, and a lot of people just forget it altogether.
Well, maybe the best way to run through the action plan is with a couple of models, and you've brought a few along with us. Do we have names for them? Should we name them, do you think, before we, you know, get too close?
Yes. We should name them. There's Dumb and Dumber and Dumber.
We might get Crawford and Archie to be your...
Your dummies?
They're not dummies, are they? They're mannequins.
They're mannequins.
Oh, OK,
yes.
sorry.
All right.
OK, so that's the right terminology, is it? A mannequin.
Correct, yeah.
All right.
Okay,
OK, so what do we run through for us,
we just
Katie,
pick
on
one
what
each?
we do first?
Sure.
Very first step. You find someone lying down like that with no arms or legs or half a body.
Yeah, this is not a good situation.
Yes.
But in general, when there's an emergency, first thing you want to do is think about your action plan, which is our doctor's ABCD. So our acronym, DRS ABCD. So first thing is checking for danger, making sure the area is safe enough for you to actually get involved and help the person. We don't want to make the situation worse, we want to make it better. So in this case, we're safe, we're going to get involved and help the person. Then you want to check for response. So R for response. We need to make sure, is this person responsive? Are they awake or are they unconscious? So talking to them, saying things like, hello, can you hear me? Are you awake?
Hello.
Can you feel this? So giving them a squeeze at the top of their shoulders. Good squeeze.
Okay. Oh, jeez.
And if you don't get a response...
No response here.
You don't use them to get down on the ground.
Sorry. So you give them a squeeze. Yes?
Squeeze the shoulders, that's it, yep. Give me a good squeeze, because that can cause a pain response. So we're trying to see, can you feel this? Can you wake up? If they don't respond, we're going to do the S, which is the send for help, which is that critical thing I said a lot of people do forget. Right. So at this stage, we sort of jump into checking other things when we don't need to do that right now. We just need to send for help. Okay. So calling out for help, saying, can you call 000?
Help! Someone help!
Defibrillator. So we get that ambulance coming ASAP. They're not responsive. That's good enough to get an ambulance. We don't need to check anything right now. Just get that help happening.
OK.
Then you want to go to your ABCD. So A is for airway. You now need to check the person's airway, like Tatiana's going to show us. So it's pinching the chin, opening the person's mouth, having a look. And we're having a look for things like vomit, blood, water, something that would be obstructing that airway. So having a look to make sure it's clear. Now, in this case, it's clear, which is good. We're going to head tilt the casualty or the person. So you're going to pull their head back as far as it'll go. So quite a big, that's it, head tilt. So we can open up the person's airway, making it a lot easier for them to breathe. Okay. And then we're going to check for breath. So to check for breath, which is the next letter B for breath, you're going to put your ear to the person's mouth, put your hand on their tummy, and you want to look the other way. Look at their tummy. Put your hand on their tummy. That's it.
Stop looking at me.
So we're going to check for breathing. So we're going to check for 10 seconds, and you want to get 2 or 3 breaths in 10 seconds. That'll tell us if they're breathing.
No, you're not getting much breath at the moment.
So in this case, no breath.
No.
Then we're going to start CPR, so that critical step of C for CPR. The big part of CPR is actually the compressions. It's really important to do good compressions, because that is the main part of the job. Yeah. We want to get that heart going, we want to get that blood pumping around the body. So in terms of doing good compressions, you want to get 3 things right, and that is getting your location right, for starters. So feeling at the top of the person's chest, you want to feel the top of the person's sternum. Yeah. Slide your other hand down the middle of their rib cage to the bottom of their sternum. That's it, to the bottom of the rib cage. Yeah. And you put your thumbs together in the middle of their chest. That's it. So that's the spot. And we want the lower part of the heart. So put your left hand, in this case, down. Put your other hand on top of that.
Yes.
That's it. And you lock it in and you tilt right over the person. So, yeah, put all your body weight on top of them. That's it. Nice. Then we're going to push down 1/3 of the person's chest. OK, so less than halfway down, but 1/3 down. And we're trying to get 30 compressions to 2 breaths.
I'm not going to break their ribs or anything, am I?
Not if you do it correctly like you're doing now.
What about if it's a woman? Like,
Yes.
a lot of people may not want to touch their breasts, you know, or what? Not me. I lie down and mine go under my armpits, so you can, you know, get my chest easily. But other women
What do
have
you mean?
turkey
Don't you
breasts.
keep doing
Yeah, sure. No, it's a really good point. It is a concern for people when they're thinking about helping someone out. Like, should we actually touch them? Should we do compressions? How do we get involved? Yes. So the fact is, when you're on the sternum, you're actually up the top here, so it shouldn't get in the way in terms of breasts being in the way. Yeah. And therefore, you're able to get the heel of your hand in the centre of the chest on the sternum, because that's where the heart is. So once you've done your 30 compressions,
Yes.
you're going to give 2 breaths, OK? You don't have to give breaths.
I'm getting sore
We're going
knees.
to have to do CPR on you.
I actually want to ask about that.
You want a
that,
cushion?
like, the breath?
Can I get you a
I
cushion?
mean, what if the mouth's a little crusty?
Yeah.
And
Yeah, no, it's a good point. So you don't have to give breath.
Okay, not, you know what I'm saying, right? Look, but it just, yeah.
Why don't you lie down?
No,
Let me
it's a
try.
really good point. Even things like...
Guys, try. Here, pop this onto your knees. Oh, I lost my ear.
It's often a good point, though. What if there was, say, blood coming from the person's mouth, you know? Like, are we going to put our mouth there? If you think this could be dangerous to me, you're not going to give breath. And that's totally OK. We're going to do compressions only in that case, and you're going to try and stick to about 100 to 120 compressions per minute.
Wow.
So today, though, we're going to give breath, because breath is the best way to do it. If we can do compressions and breath, that would be ideal.
Oh, we're about to start the breath.
So we're going to do breath now.
I've been making out with this mannequin for quite some time.
And it is quite tricky, yeah. So when you give breath, first what you're going to do is pinch the person's nose. You want to pistol grip their chin again, so holding their chin. And you want to head tilt it. So once again, pulling that head right back, lean on your elbow. So big head tilt. And then open your mouth as wide as you can, like you're biting into an apple. And you place your mouth over the top of their mouth and give a big breath. That's it. Now, don't lean on the mannequin. You don't want to lean on the person who you're trying to revive here. So take your body weight off.
She's really
I'm
getting
imagining a Granny Smith apple. That's what I'm imagining.
It's not romantic. Do you get worried about putting, like, your mouth on other people's mouths? Like...
Yeah, so this is where we can use face shields as well. Really common to use a face shield, CPR face shield.
That's what
I can see it come
Yes,
through.
correct. So Tatiana's there's got a face shield on, just for the mannequin today, but in general, you put a face shield on.
Is it the same as for kids as well?
No.
The same rhythm?
Yeah, correct. It's 30 to 2 no matter who. So it's the same pace, same rate. We're trying to continue that. Nothing changes in terms of that aspect. For our babies, what is a little bit different is our action plan. We are going to do the same doctors, A, B, C, D, but when it comes to head tilting, you're not going to head tilt an infant, so that's our 0 to 1 year old. We're going to keep that head in a nice neutral position so that that airway stays nice and open, because their airway hasn't fully developed yet, like an adult or an older child.
And not as hard compressions, is that right?
So same depth, it's 1/3 of their chest, right?
Oh.
So therefore 1/3 of this versus 1/3 of that is going to be different pressure, but we're still going 1/3. So that helps keep it all consistent, easier to remember. Yep. But 2 fingers with our infant. So you'd still do our infant on the floor there, 2 fingers, centre of the chest, pressing down. To get that 1/3 depth.
So no pump. This is all great information.
If you're doing CPR by itself and you've called an ambulance, I mean, that's great. That's the steps we need to take to make action happen. But you've got about a 5% chance of survival rate if you're just doing CPR by itself. However, if you can get a defibrillator onto that person, that defib's going to make a massive difference. That could even make more like a 70% chance of survival rate if you can get it on early. So you want to get that defib, which is the last letter in our acronym. So you're doing CPR, you want that defib to turn up, you place that defib on correctly and follow the instructions.
With a defib, can you start your car with it? There's a bit of a backup one time when you're going on a big holiday. No.
How important is it to keep up training?
Yeah, so important, because there's so much to learn. We should do our CPR training once a year, annually, and we should be doing our first aid, which is that full day class, every 3 years.
Okay.
So it's St John Ambulance, stjohnvic.com.au.
Yep.
That's the place to go, and we've got lots of different ways you can do that course, including virtually.
Yeah.
Great. We checked with our audience if they'd done CPR, no, 46%.
Oh.
Wow.
So I reckon that's a really important thing for all of us to do it, so we'll check it out.
And the great thing is, I got to teach them how to do it properly, so everything's going to be okay. Well done.